My name is Jimmy Johnston. I am a Doctor of Nursing practice student here at the University of Michigan. Currently in my final days of the program. I am an adult gerontology acute care Doctor of Nurse Practitioner student with a concentration in global practice policy and leadership. I saw nursing as a very sustainable job. Right when I was thinking about what I wanted to do with my time for the rest of my life, I thought I could throw a dart on a map, and anywhere that dart landed, I could probably do meaningful work as a nurse, right? Nurses are everywhere, everywhere in the world. So at the University of Michigan, we're so fortunate to have a couple different avenues when it comes to nursing on the global scale. Really after I found out about the global health programs here at Michigan, my next step was sitting down with the awesome faculty, Dr. Monroe Kramer, just to kind of understand the different certifications or concentrations, and I decided on the global practice policy and leadership concentration. And when I thought about it, it really aligned with my long-term goals. There's tons and tons of DNP students, but what can I do to elevate my resume and add a different piece that would make me stand out more, and also scratch an itch for me to be able to travel the world and see what healthcare is like all over. This global health opportunity was the perfect opportunity for that. It was after the first semester, my professor at the time, Dr. Blush, had mentioned a clinical immersion opportunity with the adult gerontology acute care students, where we would go to Bangkok, Thailand, and spend 2 weeks there learning about traditional Thai medicine and just immersing ourselves within a large teaching hospital in Bangkok. And so at that point, I was still looking for an international site to do my DNP project. And when I was over there, Dr. Blush, who was kind of laid the foundation for the relationship, he suggested the idea of maybe the potential of me doing my project at the very site where I was doing the clinical immersion. I already had a mentor in Thailand who agreed to work with me and help me through the process. I implemented a clinical scoring system in the surgical trauma intensive care unit at Syriat Hospital in Bangkok. All of the literature on sepsis right now, we have a very robust selection of tools that we use here in the United States and other countries that we use to recognize sepsis in patients. But a majority of those tools that we have at our disposal are cumbersome to use. They cost a lot of money because they take extensive blood tests, and they're difficult for nurses to use. So when I thought about how I wanted to implement a tool in a low-middle income setting that used readily available patient data, I educated the nurses on how to use the modified early warning score system. We talked about why sepsis is important, and then they had the opportunity to do an interactive case study with me. I also wanted to measure the attitudes and knowledge of the nurses before I implemented the scoring system, during and after. As we speak, I'm still getting post-survey data. They used the tool for 30 days. Data suggests that we did increase their effectiveness in recognizing sepsis early. So that was a really cool kind of full circle moment. Although they don't have all the fancy equipment and shiny things that we have here available to us in the United States, is their standard and how they expect and love and care for these patients is the exact same, if not even more. So that was extremely eye-opening. Even though 8,000 miles separate us, we all have the same problems. It might look a little different, but it was really cool to see that, yeah, we don't speak the same language, we don't eat the same foods, we don't have the same religions, but when it comes to nursing, like, that language is universal. There's so many alumni here that just so generously give their time, their money, for kids like me. The university and the School of Nursing just walk with you through the entire process, and it's scary to take the first step, but I mean, here I am, 3 years later, and I feel like I'm a better person because of it. I feel like I've grown as a nurse, as a student. I've made friends on the other side of the world, relationships that I hope to maintain even after I graduate, and it's all because of opportunities that the University of Michigan's afforded me.